When you hear about sports and concussions, you might automatically think of football, maybe even soccer, baseball maybe, but what about cheerleading? You don't necessarily hear about cheerleaders getting concussions. Well, it actually happens more than you think. Dr. Chad Stevens joining us here along with a cheerleader as well. So first of all, Dr. Stevens, you know this happens and you've even had to treat cheerleaders, right?
Oh, absolutely. Yes, it's a problem that goes along with a sport such as cheerleading. And girls, it's actually their most catastrophic sport, as football is for boys. And so a lot of times we think about the football injuries that boys suffer, but we oftentimes forget about the cheerleaders that are putting, all these stunts together to get the crowd motivated, on the sideline. And so we need to be paying attention to them equally, or even more so a lot of times.
And you're a Division I cheerleader, is that right, Karen?
Yes.
And fill us in a little bit more about what happened to you. You actually experienced a concussion?
Probably. The funny thing, back then we probably had so many concussions that went completely unnoticed or undiagnosed because we didn't have the awareness and doctors right there like we do now.
And what is the message you want to be sent out there? You want parents, obviously, and squads. What can they do and learn from you?
I think the best thing to do as a parent and cheerleader is to be aware of when you do get hurt or you get a head bump or whatnot. Definitely go see a doctor. You have a lot of doctors available to you now that we didn't in the past. So my advice would be to definitely get those injuries checked out.
And Dr. Stevens, you've treated, there is hope, right? So if you get a concussion, is there a chance for a cheerleader to get back at it? What's some treatments that you offer?
Yes, ma'am. So actually, Karen's point is very valid. It's best to let somebody know, be it the trainer, the coach, or the doctor early on, so that they can assess you. And, a lot of cheerleaders said, well, if I'd have just, stepped out earlier and taken a little time off, I'd probably still be cheerleading today. And so what we do now is we do a lot earlier treatment with concussions, because a lot of times in the past we would say, don't give that girl or boy any medication. Let them, kind of suffer for a few days with their headache, and that's our main indication that their concussion is resolved. But now what we're seeing is that some kids will have a concussion, girls and boys alike, and they'll have multiple days of missed school. They'll be in their room with, sounds and lights and anything bothering them. Reading makes them dizzy, all these different things. And so what we're starting to do now is treat people earlier. And one of those things that I do in my office is something called a sphenopounting ganglion block. And in the past, we would use this for migraine treatment. And we know now that migraine is what post-concussion headache is. People that have ongoing headaches after concussions, it's treated like a migraine. And so we've found that when we treat these ganglion blocks, which is about a 2-minute office procedure, oftentimes their headache goes away immediately. And you might say, well, that gets them back in the game right away, or that gets them back to cheering right away. And what it really does is it gets them back to their life right away. It gets them to where they can maybe, be a functioning child again and go to school and learn and maybe go to their homecoming activities and just do things that kids should do. And in return, as the other symptoms resolve and they don't have any dizziness and they can run and train and do things they need to do and jump and stuff, then you can get them back to their sports such as cheerleading.
Where do we go if we have more questions? We want to even learn more about what the treatments that you offer even.
Start noblepainandsport.com, and then you can read a little bit more about this device at dolor.com, or you can look up SphenoCath and you can learn more about that. It's a new treatment that we've been trying to do for years. We just didn't have quite the right catheter to do this properly. And now we're getting between 8 and 9 people out of 10, having corrective symptoms right away after we do the procedure. So it's pretty exciting. And I'm happy to say and passionate about getting people back quicker so that they're able to enjoy their youth and enjoy, if it's a Division I athlete, what they're trained to do and what their scholarship is for. And if it's a professional athlete, what they're being paid to do.
Thank you both. We appreciate it. If you have any other questions, you want to take a look at this interview again, we'll have it on our website, nebraska.tv.